This video is intended for students that have just been accepted into a cardiac sonography program. The question that I get asked the most from incoming students is, what can I do to prepare for the program? And I always say, know your anatomy, which everyone replies, I know my anatomy. But what I mean by know your anatomy is know your anatomy when looking at the heart on the ultrasound machine. On the left, we have the heart as we've all seen through our anatomy courses. It's generally upright, with the apex of the heart down towards the bottom of the image, and the pulmonary artery and aorta coming out towards the top of the image. On the right is the first image you'll likely take as a student in cardiac sonography. It's called the parasternal long axis view. The heart is imaged differently here, where the apex of the heart is towards the left side of the screen, and the aorta is going out towards the right side of the screen. The top here is actually the right ventricle. This is the left ventricle and the left atrium here. If we look at this cross-section of the heart, it's in the same orientation as the anatomical heart from the previous slide. From here you can see the superior vena cava, which brings low oxygenated blood back to the heart into the right atrium, where it pushes blood through the tricuspid valve in diastole to fill the right ventricle here. During systole, the right ventricle pushes blood through the pulmonic valve here, into the pulmonary artery, where it branches off into the left and right pulmonary arteries. From there, it returns oxygen-rich blood from the lungs into the left atrium, where blood is then pushed through the mitral valve to fill the left ventricle during diastole, and the left ventricle pushes that oxygen-rich blood through the aortic valve during systole to the aorta. The parasternal long axis view does not look like this, however. So let's see what happens when we rotate this 90 degrees clockwise. If you rotate the image 90 degrees to the right, this is basically what the parasternal long axis view looks like. Apex of the heart towards the left of the screen, and aorta to the right of the screen. Get used to looking at the heart this way in the beginning, because you will be practicing the parasternal long axis view for a while, before you move on to the next view. This is a video clip of the parasternal long axis view. At the top of the screen is the right ventricle, which is the most anterior part of the heart in terms of the chest cavity. So that means this point here of the wedge is where the probe is placed on the chest cavity of your patient. From the right ventricle, you have the interventricular septum, and then the left ventricle and left ventricle posterior wall. Right here is the left atrium. You can see the mitral valve here opening in diastole, and the aortic valve opening in systole into the aortic root. The left ventricle is filling here in diastole and squeezing or contracting during systole. Here is everything labeled. As crazy as this sounds, I would practice drawing this picture and labeling your structures. If you can draw this from memory, you'll be able to recognize everything a lot faster. Down here is the EKG and the heart rate, which should always be displayed on your exam. Here is the clip of the parasternal long axis playing with the labels. I hope this video was helpful in some way. Good luck on your journey to become a cardiac sonographer.